This morning's Health Watch, we are looking at the flu season getting worse just before Christmas. The CDC estimates there have been 4.6 million flu cases across the U.S. since the season began. 1,900 patients have already died from it. That is shocking. Dr. Amanda Kravitz is a pediatrician at Weill Cornell here in New York. She's here to help us protect ourselves and our families from the flu. Doctor, good morning.
Good morning.
What is happening with this flu season? Is this a particularly bad one?
Yes, this flu season is no joke. We are seeing more cases than we would expect for this time of year. Specifically, we're seeing influenza A, and within influenza A, we are seeing a subtype or a variant called H3N2. There are tons of these cases throughout the country, and it is causing a very, very severe flu. So symptoms that are very intense, they come on really, really rapidly, and it is very contagious. So it is spreading quickly through communities.
So is the flu shot designed for this particular strain?
So it's a little early in the season to say. There should be some coverage against this strain, but we don't know how good the coverage is against the H3N2 variant that we're seeing. We do still think it's offering protection in the sense that patients who have gotten the flu shot are having decreased severity of symptoms and aren't sick for as many days compared to their counterparts who did not get the flu shot.
So 3 children have died so far this flu season. What do parents need to know about the symptoms for their children? And how do you tell the difference between the other thing that's raging right now is norovirus? Every kid seems to be getting norovirus.
Totally. And there's definitely some overlap between norovirus and the flu. Norovirus, we think of a common stomach bug, so it's really bad vomiting and diarrhea. It's not often accompanied with some of the other flu-like symptoms, such as the high fevers, like 103, 104 degrees Fahrenheit, also the body aches and cough. So we don't typically see that in norovirus. We do see it in the flu. We are seeing vomiting in children this year, specifically with this variant of the flu, but it's still usually not too hard to tell the difference between the two things. The flu is also lasting longer. So in terms of things for parents to look out for, if the symptoms are lasting a long time, like more than 4 or 5 days, especially that high fever, it's a good idea to call their doctor, their pediatrician. Additionally, you want to make sure your kids are staying hydrated. So it's easy for them to forget to drink, especially when they have that high fever. We want to make sure they're drinking a lot. And we also want to make sure that they're breathing comfortably, that cough isn't getting to them, especially for kids with asthma or other conditions like that.
So real quick, what do you recommend people do as we get ready for this busy travel holiday?
Yeah, so holiday season is always a big culprit for everybody, you know, spreading lots of germs, lots of flu-like illnesses. So number one thing is going to be washing your hands and, of course, using good judgment. So making sure that if you know you or your family member is sick, really not going to that big family gathering, trying to limit exposure. Like I said, hand hygiene is great. And also, if you haven't already, it's not too late to get your flu shot. All
right, I know it sounds like a stupid question, but does drinking take the immune system down?
Alcohol?
Yeah.
I'm gonna plead the fifth and say.
I'm just trying to decide how far I want to go at the holiday party. I'm Dr. Amanda Kravitz. Thank you so much for joining us.
That's my kind of doctor.